February is Heart Month, a time when many of us should pay attention to our cholesterol levels, if we haven't been already. But what do those levels really mean?
We're going to start this morning by dispelling the myths about our cholesterol. Here to help is Dr. Tunis Hunt with Hunt for Wellness. Dr. Hunt, good morning. Thanks for being here.
Good morning. Thanks for having me.
All right, let's talk about cholesterol. A lot of people are concerned about it. There's the good cholesterol, there's the bad cholesterol. We think if our numbers are good,
correct,
that we are not at risk for having a heart attack.
Yeah, you're absolutely right. You know, when it comes to health and certainly cardiovascular health, one of the things that's been demonized the most is cholesterol. And we're led to believe that the higher our cholesterol levels are, the more at risk we are, and the lower they are, the more safe we are. And unfortunately, if we take that approach and only that approach, we're actually setting ourselves up for a bigger problem.
How so? Because that's what I believe to be true.
Well, you have to go back to understanding what cholesterol is and really why it's there in the first place. First and foremost, cholesterol can be very healthy for our body. In fact, over 70% of the cholesterol in your body is actually made by your body. It's not necessarily a dietary factor. And so a better question when your cholesterol is really high is why is my cholesterol high, not necessarily how I can beat it down. If that makes sense. Okay. So if we're just trying to beat it down without looking at the underlying cause, we can be missing some of the big picture here.
Yeah, because you have to have cholesterol.
You do. It's a precursor to lots of things. First and foremost, all your hormones, all your sex hormones. It's a precursor to the adrenal glands and how it responds to stress. And Lord knows we have a lot of stress in our environment. It's converted into vitamin D with the use of sunlight. And that's an epidemic in our society, is low vitamin D levels. And it helps with brain health, serotonin receptors. So the feel-good chemical in our body is that serotonin. And so they've actually seen with research, the lower the cholesterol is, maybe the more depressed or even melancholy somebody can be. So just to beat it down isn't necessarily the best strategy, and more importantly, trying to find that underlying cause of why cholesterol is high in the first place.
This is the first time I've ever heard this like this. It's very interesting, because I just thought as long as your good cholesterol number was high and the bad one was low,
that you were all right.
Yeah, so one of the other myths is that there is good and bad cholesterol. First and foremost, cholesterol is cholesterol. Your body makes one type. What differentiates it is what it binds to. It's a lipoprotein. So you can get a very low density, or LDL, or a high density, HDL. And so that's what differentiates the different types when they do a lab. And so they've deemed HDL good, LDL bad, but when you really look into it, you can actually break up HDL into good and bad and LDL into good and bad. So it's a little deceiving if you're just looking at your standard blood test.
And most of us, will go once a year. You get a physical, you get the lab results. But you're saying that just those lab results not enough?
It's not enough, because this is what literature and actually statistics are showing is out of the population of individuals who are getting heart attacks, heart disease, and so forth, 50% of those individuals actually have normal to low cholesterol levels. So in other words, just having low cholesterol doesn't really protect you any more so than having high cholesterol. And it begs the question, if cholesterol really is this smoking gun, how come it's absent in 50% of the heart attack victims?
Right, that's a good point. So your office does something different? You check for cholesterol in a different way?
Yeah, so we look at cholesterol in a more detailed panel. There's a panel out there called VAP test, VAP, and instead of the standard lipid panel that looks at like 4 different markers, this looks at 15. And as I mentioned, LDL, HDL, all those different lipoproteins can actually be broken down a little bit more detailed. And when you know those a little bit more specifically, you can actually glean really what the underlying risk is. And at the end of the day, just because you have high cholesterol doesn't mean you're at more risk, because what's really causing most heart problems is inflammation. That's really the underlying cause of most disease, and that's really been known, for a couple decades now.
And if you were going to say in 30 seconds, give us a handful of things to stay away from or not do to prevent heart disease.
So again, lower inflammation, so low inflammatory diet, low sugars, low refined carbohydrates, more green leafy vegetables, reduce your stress, get more sleep, better exercise, reduce alcohol consumption. These are all lifestyle habits, which is good to know because we have the control over our own health if we let it be.
Doc, you're taking away all my vices.
I know
it's
I didn't say you can't have it. I'm just saying if you want to reduce inflammation, situation, you're going to want
Basically
to
saying hit the lottery.
That's
what
right.
you're basically going to say.
Amen, right?
Get rid of that stress.
Dr. Hunt wrote the Adrenal Code, and that's something that you can download for free if you go to theadrenalcode.com, theadrenalcode.com, filled with great information. You also host free dinner talks. Can you quickly tell us about those?
Sure. All across the region of Charlotte, we give away free dinners to those individuals who want to learn more about health and nutrition. We have a few coming up this month, and we talk about cholesterol, diabetes, thyroid, and so forth. So if you're interested, contact us.
Very good. To register for the free dinner talk, visit freedinnertalk.com, freedinnertalk.com. You can also call Hunt for Wellness. The number is there on your screen. It is 704-588-1792, 704-588-1792. Hunt for Wellness. Thank you very much.
My pleasure.
Good to see you. Stick